I'm going to demonstrate a clinical exam of a dog. This is Josie. We're going to do the long, complete clinical exam of the dog, and elements of this exam can make up, whether it be the OSCE question. There's several different versions of clinical exams, and there's some parts will be excluded on some of the exams. And so you're going to have to read and listen to your instructions carefully and attend your practicals, because we talk about all the differences in the exams and the practicals. Okay, so the first thing you're going to do is, if your patient is already on the table when you come in the room, you want to assess their demeanor. If they're friendly, go ahead and speak to them, acknowledge them, make eye contact, give them a pet, get them nice and relaxed. If the dog is trying to hide behind the owner or seems very uncomfortable, you may want to speak to the owner and give them a moment for the dog to get used to you before you dive right in and start opening their mouth and staring in their eyes and all that. Okay, so the first thing you're going to do as you speak to the dog and greet them is you're going to look at their head and face and making sure it's symmetrical. You're going to make sure that there's no swellings, their eyes are very even, their face is nice and balanced. You can tell by her that it's all fine. Okay, from there, we're going to start at the tip of the nose and work our way back to the tail. So you're going to look at the nose, both nostrils, make sure they're clear, no discharge, the air is flowing through them. Okay, you're going to move on to the eyes. Okay, make sure there's no redness, no discharge, no growths, no problem with the eyelids. Make sure you have a glance at both eyes. Okay. Going to have a look in the ears, making sure the ears nice and clean, no smells, no discharge, no parasites, no problems. Look in both ears. What you do to one side, you have to do to the other. Okay, have a look. Next, we're going to move on to the mouth and teeth. First thing, before you open their mouth, let's go ahead and have a look at the general condition of their teeth and gums. You can assess the mucous membrane color, making sure it's nice salmon pink. Capillary refill time, less than 2. Have a look at both sides, making sure all the teeth, she's a young dog, so making sure all the teeth have come in correctly. Okay, now you're going to open their mouth. Have a look inside, making sure everything looks normal, no growths. Most of them don't resist this too much, but don't get too much fight with them. If the dog, if it upsets them, come back to it again later on in the exam. Alright, from there, going to come back. I feel their lymph nodes from behind them. The first lymph nodes you're going to feel is submandibular. They're located next to the salivary gland. It's very easy to feel the salivary gland, so make sure you don't mistake salivary gland for lymph nodes. Okay, and from there, we're going to move on to the prescapular lymph nodes. You just find the point of the shoulder and the scapula. You go just in front there, and you're rolling that skin between your fingers. Some dogs will squill when you do this, because you are pinching them slightly. Okay, that'll feel fine. If you want to move on to the final lymph nodes that are palpable, you can go ahead and go back and get your popliteal lymph nodes out of the way. The easiest way to locate them is to find essentially their knee and go straight back from their knee, the back of their leg, and you can feel a little popliteal lymph nodes. And check this on both sides. Okay? All right. From there, go ahead and listen to the heart and lungs. When you listen to the heart, you want to, when you're first listening to it, listen to it for at least 10 seconds on each side. You can use your fingers to find the apex beat, then place your stethoscope. At the same time, as you're listening to the heartbeat, you can also reach back and feel the femoral pulse as well. Okay. At this time, I am not going to give you a heart rate, because this is a dog you guys see again and again, and you guys will use that heart rate for exams. So I'm not going to give you her value. From there, you're going to move on and do your exam of the respiratory system. of their lungs. You can take a respiration rate just by watching the dog visually. This is possible. You can also do it through auscultation. If the dog is panting, of course, you're going to get an elevated value, and it's not going to be accurate because the dog is not actually in respiratory distress. She's just excited. So even right now, with her panting, it's not going to be an accurate value. But when you sculpt the lung fields, you do need to do this in at least 2 places. So you want to sculpt more ventral lung field. And you are going to hear a lot of noise from the panting. What you do to one side, you have to do to the other, so make sure you sculpt at least 2 places on the other side. Okay, and from there we can move on and do abdominal palpation. Again, it's something I like to face the dog away from me as I do it. It's very important to practice this as much as possible, whether it be on your own pets, as you guys are seeing practice and things. Put your hands on as many pets as possible. Cats are quite helpful because they're much easier to feel. They're not generally as fat as dogs. It's generally more difficult in older spayed bitches just because they have quite a bit of abdominal fat. Puppies, you have to be very gentle because they don't know enough to tense their abdomen against you, and so you can get pretty rough with puppies fairly easy when you're first starting out. So you have to get them to kind of cooperate with you a little bit and stand up. It's usually easiest to lock your fingertips kind of in a shape like this, and I go from cranial to caudal as you just slide along, just letting everything slide over your fingers. A lot of dogs, if they're grunting and they're very tensed against you, you're really not going to feel anything. So continuing on our exam, get back to the business end back here. You always need to take an animal's temperature, and we're not going to do that today to demonstrate. Most of you know how to do that. You want to go ahead, you want to make sure their genitalia all looks fine. No parasites, no problems. You want to make sure to double check that the animal is the sex that is in the record. You want to make sure males, Josie here is a female, but if it's a male dog, you do want to palpate their testicles to make sure everything feels normal, their prepubes, and all that that's expected on the clinical exam. From there, since we have reached the tail, it's now a good time to do a skin check. And so simply what you want to do is reverse the hair coat, have a nice look, be very easy over the tail head if they have fleas, if they have problems, dry skin, different things. Have a nice look at the hair coat. From there, don't mind if she lays down for this, you're just going to do some limb palpation. It's a good time to check, making sure their toenails aren't overgrown, split, cracked, no problem. Making sure all their limbs feel normal, no issues. Have a look at the paw pad, make sure no paw pads are cracked, any problems. Have a good look. You can stand them up and do the same sort of thing, feeling of all their limbs.